everyone, my name's Clair Haydon. I'm a consultant occupational therapist working at Cheshire and Wirral partnership, and I also lead the adult autism service there. I know that we're experiencing a really scary and stressful time at the moment with coronavirus, and there is an increased chance that we might need to access physical healthcare services or even mental health care services in the coming weeks and months, and that for autistic people where that is typically being quite difficult, I know that that might be contributing to people feeling worried or stressed. So I thought it'd be a good opportunity to talk about a hospital passport or a health passport and how that will help you plan and prepare for any health interventions you might need in the future. It might make you feel more able to ask for support if you need it, and it will enable health professionals to know the best way of communicating and intervening with you to offer you the most effective treatment and the best outcomes for your needs. So for those people who haven't seen a hospital passport, this is one we use, which is devised by the National Autistic Society, and you can get that off their website at autism.org. You can see on the front page that's some personal information, so you can either use this in its entirety and fill it in either online or in paper form and give it to professionals that are working with you, or you could use it as a framework for just listing some reasonable adjustments that could be added to your electronic health record. It's entirely up to you. But this gives a framework. It does focus on three main areas, which I think is really useful when you're thinking of any reasonable adjustments actually. So firstly, for this, it's how I experience pain and how I communicate pain. And when I'm talking about pain, when we're thinking about mental health, that might also be distress. So how you can access or request support in a crisis. So autistic people have said to me often that they find it difficult to describe how they're feeling, to identify or express their emotions, and for physical pain might struggle to differentiate between what's a throbbing pain or a sharp pain or a dull ache. And so it's really important, if that's something that's difficult for you, that you put that down and you let health professionals know that, so they know they need to ask questions or assess you in a different way. So you're not feeling stressed that you can't answer in the way that they might expect. If you've got a high pain threshold, that is that you could injure yourself, or that you've been ill in the past and it hasn't really registered as pain, or you haven't easily felt it as pain, then that again is really important to put down there, because if you're then approaching a team and saying I'm in a lot of pain and there's nothing non-verbally that would suggest that you are, or your intonation hasn't changed, or your facial expression hasn't changed, which is often the case for autistic people, then that might not be taken seriously. But if they know that your threshold is where it's at and you're then saying you're in pain, they know to take that seriously and respond appropriately. The next section is around things I struggle with that cause distress and how you can avoid distressing me. Now, obviously, if you're attending a health service with a mental health need or a physical health need, especially at this time where everything is so stressful and scary, the likelihood is you're already going to feel distressed. So it's really important that you think about what will minimise that distress when I'm having to seek support or help, and what will actually exacerbate that distress, what will make it worse if I go into a health setting. So for lots of people, that might involve sensory sensitivities. So if there's a lot of noise or a lot of people or bright lights, then that can be really distressing for some people. And although we can't get it environments necessarily in an emergency situation where there are no other people, for example, there's always slight tweaks that can be made to the environment to make that less stressful or distressing for you. For example, shutting the curtains or putting you in an area of a building that is quieter. Some people have said that uncertainty is really difficult for them, so not knowing what's happening or what's going to happen next. And so having advance notice of any changes, being told of what's going to happen and what to expect, actually alleviates a lot of anxiety for some people. So that might be helpful for you to note down or say. Having consistency, so perhaps having on a shift, if you were in hospital, a certain member of staff or a couple of members of staff that you feel comfortable with discussing or talking to. In mental health services, that's really important. Again, having consistent staff where you feel that you can speak to them, you can trust them, and that rapport is already established, so you're not having to repeat yourself all the time. And then finally, how I would like you to communicate with me and how I communicate. And lots of people feel really stressed going into a health situation if they're expected to make small talk, or have banter or respond to humour. And if those things really do stress you out, it'd be worthwhile putting that down, because ultimately that could deter you from going to that health service in the future if that's something that has upset you or leaves you unsure of what somebody's saying or meaning or intending. Other ways in which you can communicate, you might only like to talk to one person at a time, and so that's again something really important that you could put down on your health passport. You might say that you like a lot of details, so you can think about all options or research what treatment options are available to you. Alternatively, you might find too much detail overwhelming, that you can't process all that information, and you might just want clear and concise information in a simple format. Again, it's completely individualised to you. You might also need time to process information, which is often a common feedback that we hear from autistic people. And so again, that would be really helpful, that people give you information in bite-sized chunks that you can really process and understand. So these are just some ideas. There are some guidance notes again on the National Autistic Society website in how to fill this out, and other considerations you might want to think about when thinking about what would make intervening with health services as pain-free and as easy as possible. But I hope that whistle stop tour has been helpful for you. And ultimately, please, 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 if you do need support and you do need to ask for help from healthcare services, please do that and don't suffer on your own. Okay, take care everyone. Thank you so much. Bye.